kick off with an intro of the webinar. So hello, everybody, and welcome to our webinar on the Technical Assistant Marketplace. My name is Allison Blakemore, and I'm a manager here at Health Solutions, who has been working with our various TA recipients across the past 2 years. We're excited to have you join us as we explore the funding opportunity provided under California's 1115 waiver, Transforming Medi-Cal, previously known as CalAIM, and how it can be utilized to build out current and prospective ECM and community supports providers programs. Our goal with this webinar is to provide you with a comprehensive understanding of how to access the TA marketplace, the projects available within it, and how they can impact and improve your program operations. This will be done through a few short slides and a panelist conversation. I want to do a special welcome to our panelist, Ethiopia McKinney, which is the Executive Director of O Community Doulas and the founder of Community.org. Leah West, who is the Chief Executive Officer and founder of Harvest Healthcare. Belen Arangure, who is the Director of Care Management at Venice Family Clinic. And our co-sponsor, Adimika Meadows Arthur, who is the Executive Director of HealthTech for Medicaid. Thank you to all who joined. We appreciate you taking the time out of your day to join this webinar and learn about the resources available on the TA marketplace. All right, just a few housekeeping rules. You can enter any questions you might have throughout the webinar in our Q&A chat. You may also send any questions directly to info@copehealthsolutions.com. We will send out a PDF copy of the presentation and a link to the recording with a written Q&A. All right, so just briefly, we'll go over the TA Marketplace waiver timeline in this presentation, a brief overview of the projects and domains, how to access the marketplace, and then our co-sponsors will go over briefly on state and national connection from the TA Marketplace, and then we'll go into a panelist discussion and a brief Q&A at the end. All right. Next slide, Alice. Thank you. All right, so we are the PATH Technical Assistance Marketplace. So the PATH Technical Assistant Marketplace is part of one of the initiatives under the Medicaid waiver, which is titled Providing Access and Transforming Health, which is a $1.85 billion initiative. It provides resources to community-based organizations, counties, providers, and local entities to help them improve their infrastructure to deliver enhanced care management and community support services. The Technical Assistance Marketplace is an initiative that provides ECM, enhanced care management, and community source providers with access to state-approved vendors to help them build out their programs. The PATH Technical Assistance Marketplace is fully funded through the state directly to the vendors to help these organizations build out their programs. The marketplace opened in February of 2023, and it's a 5-year initiative. Next slide. Next slide. Perfect. So there are 7 different domains under the TA marketplace, each with its own special area that a vendor can help support the program in. Cope Health Solutions specifically is a vendor in all 7 domains. We have extensive experience across domains and work with all of our clients across these, completing and executing various projects. On the next slide, we'll go into a bit of those projects. So the 7 different domains include building data capacity. Some of the projects the TA recipients can access are help with integrating risk stratification tools to help them identify high-risk members. They could get support in integrating and assessing different platforms, care management and billing platforms available. And you can obtain support in configuring data analytic capabilities for your reporting requirements to manage care plans. The community supports domain is really focused on helping entities build out their community supports program. So any of the 14 community supports under CalAIM can access the marketplace to help them configure staffing models, workflows, integration opportunities for community support services within an entity. Third domain is engaging in CalAIM through Medi-Cal managed care. This is really support for reaching and obtaining those managed care contract goals. So developing your staffing and financial models in alignment with your managed care contract requirements. It can be application support to contract with a managed care plan or obtain IPP or cited dollars. And it can be support with developing billing and reporting best practices in alignment with your managed care plan requirements. Go to the next slide. All right. There's also a domain called Enhanced Care Management, and that really centers around building out your enhanced care management program. So developing outreach strategies, engaging with the different populations and focus, developing any types of workflows that helps you coordinate better with the different providers that you will be engaging with. Promoting health equity helps organizations integrate health equity practices that really focus on increasing your engagement with the identified populations of focus through the managed care, through the CalAIM waiver. Supporting cross-sector partnerships really focuses on improving your network capabilities and access and integration with different community supports and providers and clinics within your service area. So vendors on the marketplace can help you develop shared team models, integration models, workflows with other clinics and CBOs, really help you understand how to navigate a network in your service area to expand service availability for your members. And then the final domain is really focused on workforce. So developing workforce strategies to expand your current workforce or to ensure that you have a workforce pipeline so that as your program grows, you're able to meet those member numbers and to ensure that your members have quality of care. It also includes developing job descriptions and staffing models and ways to engage with different types of staff in your organization. Go to the next slide. Great. And so just some background on the TA marketplace as well. There's primarily two types of projects that individuals can access on the marketplace. They're categorized as hands-on and off-the-shelf. So off-the-shelf are projects that are pre-packaged, such as training materials or a program manual, something that can be done with little to no interaction with a vendor and a recipient. And then we have hands-on projects that are typically more tailored to an organization and their specific needs or requirements. So those require a higher level of engagement between the vendor and the recipient. For our organization, we tend to use those to have weekly meetings and interactions with our clients. The approval timeline for each of those is a little different as well. Hands-on projects typically have a longer timeline, as DHCS and the marketplace really need to assess those projects thoroughly to ensure that they align with the requirements of the initiative, where hands-off are pre-approved projects that the TA marketplace has already reviewed and approved from the vendor. Next slide. Great. So just a high-level overview of accessing the marketplace. So in order to access the TA marketplace, you do not have to be a contracted ECM or community supports provider, but you do need to obtain an attestation. There's multiple ways to obtain an attestation, but the common ones are either through a managed care plan in your service area or through DHCS. Through their online portal, and once you obtain either one of those, once you've obtained an attestation in either of those manners, you will be able to create your marketplace application. For the application, DHCS and the marketplace will review your program setup, your attestation to ensure that you align with the requirements outlined in the TA marketplace, and then you'll be approved as a TA marketplace recipient. This is really where we come in, or any vendor comes in, to help you develop the scopes and budgets to submit to the TA marketplace to obtain the project support that you would like. I'll move to the next slide. Perfect. And I'll pass it to Adimika for a state and national connection conversation.
Amazing. Well, thank you, Allison. It's always great to have these sorts of conversations. So my name is Adimika Meadows Arthur. I am the CEO and Executive Director of a nonprofit organization called HealthTech for Medicaid. We have been at the forefront of Medicaid innovation well before it was sexy. And I have a long-standing relationship in the state of California as one of the original authors of the 1115 waiver in 2005 in the state. I'm going to just take a few minutes because I'm in between you guys and the really juicy stuff today, which is the panel, to just give a little bit of a state and national connection. You know, why are we doing this sort of work? What is, you know, where is this coming from on a federal level, and where to go? Alice, you can go ahead and move to the next slide. Thank you. So we just heard a little bit. Oh, the first slide, I think. Oh, is there a slide before this or no? Perfect. We just heard a little bit about California, and I think one of the things I want to walk through is the current 1115 waiver in California really focuses on CalAIM and these PATH initiatives. And so CalAIM stands for California Advancing and Innovating in Medi-Cal, right? And that is really to transform the Medi-Cal system. And PATH is really stands for Providing Access and Transforming Health. And that is this kind of, as Allison alluded to, this $1.85 billion initiative kind of aimed at supporting how do we create the infrastructure and the ecosystem to actually assist the 1 in 3 Californians that are actually on Medicaid. I want to make sure that, you know, there are a couple areas that Allison pointed out, but 2 areas that have the most growth and additional kind of funding. One is really in ECM, which we heard a little bit about, that enhanced care management. The other one in community supports, which was one of those 7 domains, as well as the justice involved services under CalAIM. These are some of the most novel and unique things that we're seeing that also other states are kind of keeping their eye on. Now I'm going to move a little bit outside of California into the federal ecosystem, and then really kick us off for a really rich and wonderful conversation. Next slide. So why are we doing these sorts of TA marketplace and technical assistance things? What we're seeing across the federal system right now is that there's a real focus on value-based care. Now we've been talking about this bit of a buzzword for quite some time, but I think that, you know, we're getting a lot of pressure between our payers and our providers on how we can better, with the dollars that we have, enhance people's quality and duration of life. And I'm certain we'll hear about this from the panelists today. I think it would be remiss without talking about the federal government, CMS specifically, along with other agencies, focus on health equity. And so those are a lot of new policies really targeting health equity and how do we reduce disparities and improve access for underserved populations. This is really a unique time where we're really relying on our community-based organizations who traditionally have been our entree into really serving and working with the community well. And then obviously I would be remiss to not talk about data interoperability. And I think the OMB and many other federal agencies are really pushing and deeply in the last 3.5 years towards improved data sharing and interoperability. How do we demand access and enhanced data systems and compliance? And I know, Allison, I'm sure you'll touch on some of the products you guys have in regard to doing some of that work as well. But I think the other thing we're seeing across many other states across the country is, while California has this marketplace for technical assistance, you know, compliance and strategic positioning, how do we better ensure that we're going about this? And so I'm looking forward to seeing questions that we have come through and answering as we go along. Next slide. And I was going to talk a bit about PATH, which is one of the areas, but I think what I'm going to do is open up to really making sure that we're providing kind of the community and lived experience of how this program is working. You know, where are there gaps in TA? What could we be doing differently or better? And specifically, you know, the success stories and the impact. Like, that's what we really want to know. Like, what are the, you know, we know there are similar initiatives nationwide, but how is it working in California, and ways in which we can have it be replicated or adapted. And so I want to open up to our panelists at this particular point in time. So we can go to probably the next slide and then, or maybe pull slides down altogether. Yeah. And I think the panelists were introduced earlier, but I want everyone to at least start in their own words, just introducing who you are and what you do to our audience today. And maybe I'll start with you, Ethiopia.
Okay, that's perfect. My name is Ethiopia McKinney. I am the Executive Director of O Community Doulas and Community. And so we are in the PATH marketplace. We are a recipient. So the way we got in, because we didn't have any contracts, we got in directly through DHCS. So we were able to get that attestation letter, and then we became a recipient, and then we went into the marketplace and started to shop around for vendors. And through that, they had a couple of webinars where the vendors came on, and then they also have on their site the list of the vendors, and you can see which area. Let me don't go in. So let me just let someone else. I'm going into the thing already. Let me let someone go on. Ethiopia McKinney, yes.
Amazing. And I'm gonna go ahead and move to you, Belen.
Hi, good afternoon, everyone. I am the director of the Care Management Department at Venice Family Clinic, and I have operational oversight of all care management programs specific to resource case management, enhanced care management, and dabbling a little bit into the Medicare world.
Amazing. Leah, let's move to you.
Good afternoon. My name is Leah. I am the CEO and founder of Harvest Healthcare Solutions. We provide enhanced care management and community support services to Medi-Cal members in California.
Amazing. All right, and Allison, I'll have you kind of wrap us home. I know you introduced yourself a little bit earlier, so maybe I'll start with a first set of questions. I wanted to try to set the stage with relevant policy landscapes, and but I'd love to know kind of what can you share a little bit about the integration of the TA PATH marketplace that is that has influenced the way that you guys are helping with operational efficiencies at COPE?
Yes. So the way that we're helping our different recipients with operational efficiencies, utilizing the TA marketplace. So the way that we do that is for each of these organizations and the women on this panelist, we really help them understand the resources available to the TA marketplace. So most of our organizations that we work with are small community-based organizations that may not have the funding to go out and get consultant support or even do some of these infrastructure improvement operations, from time capacity, but also from funding. So we help these individuals understand what's available to them and what resources need to be prioritized. So if they're really trying to contract right away, we're going to help them develop their program manual, their documentation, their staffing model. That's all required to get that initial contract. From that, we'll see what else needs to be prioritized. So do they need to get in a care management or documentation platform? All of these things need to happen, but at the timeline that's appropriate for them in order to make them efficient and successful in the initiative.
That's great. I'm going to move to you, Belen. You have pretty extensive care management background, and I'd love for you to just give us, from your vantage point at Venice Family Clinic, how do you navigate the complexities of aligning both these kind of regulations, and what strategies have proven effective in leveraging kind of the policies to enhance care coordination and patient outcomes?
That's a really great question. If you can clarify for me a little bit in terms of the policy, because ECM is quite, for lack of better words, quite a monster to manage, to be quite honest. And so a lot of this workup has been really helpful to be in a team-based kind of unit with COPE Health Solutions. They came in during our strategic planning, so they were already pre-identified to support us, and I'm so happy that they were already working in the TA marketplace, and so we're able to very quickly come in, consolidate all of the information that we had, and then became a very quick resource for us to have an ECM program manual that we could reference, that we could edit, did some mapping of community resources that was also incredibly helpful as we're considering considering to expand out into the South Bay. And I think that that provides additional time for someone in a director capacity to be able to focus on all this up and coming information regarding, changes in how the financial modeling will work across different health plans, any new incoming policies that are coming in and how those will or won't affect our teams. So I really do appreciate their time. And I think that's how we're able to kind of cycle out the time, have a little bit more bandwidth, and focus on some of the things that you're talking about.
Yeah. And can you give us some examples of how ECM has really changed the tenor and tone of your the recipients and the people that your beneficiaries, people that you serve in your community?
I think there's a lot more clarity. I think I came into the team 9 months in. I think I can say that we have a lot more clarity and standardization around the way that we want to move forward in providing and rendering ECM core services. And that's really kind of taken the team aback to refocus into the things that they're doing. So knowing that there's written documentation that outlines what their day-to-day roles and responsibilities are so that they don't have this overwhelming sense that they are the end all be all fix it all in terms of what we're trying to accomplish in the CalAIM ECM world.
Great. I want to move to you, Leah. You guys do some work at Harvest Healthcare with seniors, correct? Can you tell me a little bit more about the constituent population and if there's anything unique and interesting about how, the TA marketplace has either enabled or hindered your efforts in providing tailored care solutions for seniors?
Yeah, so we started off offering services for seniors only, but once we started working with Cope Health Solution, they were able to expand where we work with all Medi-Cal members now. They have provided us with, they help structure the entire business. It has been an amazing experience. I felt overwhelmed at first until I found Cope Health, and then just having them meet with me weekly, having them help me with the outlines, the emails, the reaching out to other contracts. It has been great. There hasn't really been a negative experience at all providing services for seniors. Anything I need help with, I can ask Allison or the other team member who I work closely with, and they're able to get me the answers ASAP. It's unreal, actually.
And I want to just mention that it's timely, right? Because in California, just recently, we opened up care for individuals that are 50 and older, right? So it's not just what we would consider to be traditional seniors. And so, can you tell us about how that demographic shift has changed, the ability for you to help more folks in your community, or what are you seeing as growing populations, and any sort of patient story or way in which we can kind of see or feel how this is making a real difference?
So there's a huge need. The need is so great that we're actually trying to figure out how to hire more staff right now because we're really overwhelmed with the need. I find the issue right now is most seniors are on strict and limited income. So it's hard to find senior housing, senior placement, assisted living facilities for them. However, Allison did mention partnering with landlords. And so we have been partnering with landlords who are a little more lenient and they understand our program to help place these people. And so in the past month, we have been able to place 4 people into permanent housing just because we have really been doing the outreach. Allison was able to give us a list of places to outreach to, and it's been very helpful.
That's amazing. That really is improving people's, whole life. Ethiopia, I want to move to you because I think your population is very unique, also very needed. And I want to, and you have kind of a two different kind of ecosystems, one with doulas and other ones with community, and your platform in community health. Can you, kind of given these recent changes, can you tell us how this may have changed your service delivery models or what you've learned in the process of this particular process?
Okay. I deal a lot with Black maternal health. That's how I came in, obviously, as a doula. And so with ECM and CS, it really has helped us in terms of our workforce. So the doula actually can get help from the CHW. And for me, it provides that ecosystem. And so the community health worker can come in and educate the entire family, because what we know in terms of the issues in terms of mortality rate and the morbidity rate with Black women and Black infants, it's because we don't have that wraparound care. And that's what ECM is, right? So we have where sometimes our doulas are acting as ECMs for certain populations, and so that they have that one person and that wraparound care. What happens is a lot of times our systems was in silos, and so someone would have to repeat their issue over and over, what is happening with them. And so now with our birth equity and with the ECM and the CS, we can now have one person with their ECM care leader have a continuum of care. And I think that makes a big difference in that population.
That's amazing. I want to this is really deep insights, and I think gives us some visualization about how broad and different. I mean, obviously California is a very large state. You've got 58 counties, lots of diversity between, the coastal areas, the inland areas, the northern part of the state, the southern part of the state, Central Valley. But I want to pull a few questions that we're getting from the audience just to make sure that we are adequately meeting people's needs online. This question, I'm going to have all of you guys answer, or those who you feel like you want to go ahead and jump into this question. Is getting individual providers credentialed a part of the process that you worked on in this? They indicate that a large barrier to access is that some specialties have years-long waiting lists, right? And the process for credentialing as an individual provider can be complicated. Is this something that any of you guys addressed specifically? And if so, would you mind giving some insight? I'm seeing a few people shake their heads. Is that idea would you start?
I'll go first. It takes a while to not credentials, but just the contract in itself. It takes a while. It can take up to 3 to 4 months, depending on how fast the healthcare plan moves. So you have to be really patient. I try to email them. If I don't hear from them, I'll email them, or Allison will email them, just to see what's going on, the timeline, how much longer we have to wait, but it can take a while.
Great. All right. So one of the things yeah, please go ahead.
Sorry, Adimika. Just to add some context. So the difference between maybe clinical providers that you might be referencing in the year-long process is that enhanced care management community supports providers are not licensed providers. They get an attestation and a contract through their managed care plans, but there's not really a full year-long credentialing process. As Leah spoke to, the full contracting and site credentialing should really fall within that 3 to 4 month timeline is what we're seeing. Obviously, there's different counties that have excessive ECM and CS providers, so it might be a little bit longer, say 6 months, but it's not a year-long process for enhanced care management and community supports at this time.
Amazing. Anyone else who want to bring some highlights here around credentialing? Ethiopia or Belen? No? Okay. Let's move on. I have some other questions, and I'm going to start with Belen. I'm going to start with you. So, considering the focus on high need populations, how has this influenced the way that you're thinking about strategically coming about this at Venice Family Clinic? And you kind of alluded to the fact that you guys were doing strategic plan, knew you needed help, and then and that's kind of your pathway. Can you let us know, a little bit more about how has it been beneficial or challenging, and what are your current kind of opportunities today?
Yeah, that's a great question. Both a benefit and a challenge, I think, has been in some of the ways that COPE has helped us kind of think through some of these barriers that we knew were there, but we didn't quite know how to address them. And I think one of the examples that I can pull from was the case conferencing. We have more case management programs that exist outside of my direct oversight, and there could be a lot of overlap with those departments. And so one thing that I really appreciated is COPE coming in, having these interviews with staff members, with directors, leaders of those particular roles, to see in the future, as we're building these things out and growing as a team and an organization, that is there any opportunity to collaborate on any case conferencing, to bring teams, so bridge that gap, bridge those bring those teams together and start having conversations across different programs, ECM. We also have a summit program, it's called, for individuals that are experiencing substance use disorder. And so that was an opportunity that was identified there. So difficult, but definitely an area of an opportunity that we could try to take advantage of to bridge that gap.
I want to lift that up a little bit more, because I think that's a population that a lot of folks are really wanting to learn a little bit more. Can you tell us, what some of your current strategies have been like in working on this specifically with the SUD population?
Partnering, trying to partner as best as we can and breaking down those silos. So leveraging, what one individual knows versus a different one. There are many times that we collaborate with the summit counselors to verify if, we're in a process of considering disenrollment for our patient. What has that substance use counselor's experience been with that patient? Are there any best practices that we can take away from what their relationship has been with that individual? In-person site visits or in-person visits with the patient. Recently tested that out with one of our ECM case managers and that summit counselor, so that they could partner, go and visit the patient in person and get them the care that they need. And it wasn't fragmented care. It was together. These two individuals that are trying to support them with this one overarching goal were there to provide and receive the same message.
This is beautiful. And Leah, I want to jump to you kind of next, right? Have the changes in kind of other things like Medicare, right? Or other areas kind of impacted your operations and services? And can you give us maybe a story of how this work that you guys have done in preparing through the technical assistance has really improved the lives of the people who are walking through your door?
I think some of the supports. Oh, I'm sorry. Is that for me or someone else?
It's for Leah. It's okay.
Oh, sorry. Go ahead. No, go for it.
It's okay. The changes have actually been good for our clients. I feel like it's a little more like people are able to. So okay, I'll tell you a story. I have a client. She was able to have her insurance pay for her assisted living facility stay. Prior to the changes, she didn't have the money. Her family could no longer take care of her. Her family was really actually stressed out and just kind of done with the situation, unfortunately, because it can be, it's stressful for the family to take care of an elder. So she moved into an assisted living facility. She was able to get rehab. She was able to kind of walk around, but through rehab and Medicare paying for her stay, she was able to gain her strength back. So I believe that Medicare, they have really good changes for the seniors. Also Medi-Cal, like all of the services they're providing now, I feel like it's going in a great direction right now. So
that's amazing. Allison, this is where I want to like ask a little bit about impact, right? And how do you guys measure the impact of the technical assistance, provided through the TA marketplace? And if so, like, what are some metrics or outcomes that you guys track or look at?
Yeah, great question. So probably one of our largest measures that we're tracking with our different clients is member enrollment. And that really hits on a few different areas, right? It hits on financial sustainability, it hits on maximizing program operations, and then quality outcomes. So quality of care gap closure. We're looking at those as well to understand the model of care and the impact that it's having. So those are some key areas. The other things that we're looking at and that DHCS is tracking is patient satisfaction and retainment. So we can enroll a member. That's one kudos. But then being able to sustain a member, and these are high need members, hard to reach, high need members. So being able to sustain and retain them for the period of time of enrollment through 6 to 12 months is really what we look at, and being able to hold on to those is a big KPI that we track with our members, with our recipients.
I love this. I think I'm going to you a little bit around community engagement, right, and support, right? You kind of alluded to this earlier about, in order for you guys to make a difference, not only in people's like lives, right, but also in the outcomes itself, you have to kind of integrate technology and use tools. Can you tell us how any of this impact has impacted your ability to provide better comprehensive services, or how you've adjusted in designing and delivering the services you give?
Okay, that's a great question. So one of the domains is data. And so through that domain, you can get help in terms of what data you need to capture in terms of your electronic health records, and then also work through your workforce to say, okay, this is exactly the kind of information we need, the kind of data we need. And I know for me as the community organization, outreach was one of my biggest things. And so combining outreach with actually capturing that data really helps not only the CBO, but it helps Medi-Cal, it helps the provider, it helps the MCP to have the correct information and what is actually happening on ground. I know one of the things that we're working on, what I had alluded to, is actually the numbers, how having the doula, having the ECM, having the community health worker act as a maternal community health worker in terms of educating the family, how does that actually improve Black maternal health? And so these numbers actually have to turn into better outcomes, not just numbers to have numbers. I think a lot of times we just like numbers, but what is the impact? Uh, is the mortality going down? Is the morbidity going down when we have this information? And so having the data domain, having the workforce domain, and having the path marketplace, and really in terms of providing access, not just providing access to the patient, but providing access for us, the CBO, to do our work the best way we can.
Yeah, I mean, it's data is my love language as an epidemiologist by training. So I appreciate hearing a little bit about this. I would love to just go a little bit deeper into how are you guys balancing the need for innovation, right, with the constraints of trying to like meet the needs of the populations that you're serving. And then Allison, I may kind of end with you guys or you a little bit around how you think this is impacting the statewide workforce, right? And just giving us some context around, in working with the CBOs that you've been working with specifically, how you think this is actually helping there be more specialists that can see Medi-Cal patients, how there's more case management services, or there's more alternate components of the workforce, like community health workers and others. So let's start with you guys. I'll start with you, Ethiopia, go to Leah, and then Belen. Really, how is it that you're balancing the need with innovation and also fostering like meeting the need of the demand of the services that you have today?
Again, another good question, because I'm an innovator. So for us, we have an app, but then we also want to look at the needs of and that's what we started. So for me, I have a lived experience where I've called 211 before. I've been homeless before. And so I know what I needed in terms of that wraparound care, that kind of warm hand holding. When I hang up the phone with 211, that's it, right? And so I know that for me, I needed it, or I would have wanted something where they have my information, they're going through the care coordination with me. I don't have to tell my story again because my daughter's in the hotel room with me and I'm re-traumatizing not only myself but my daughter. So I know I wanted to have an app that they have a particular care coordinator that knows their story, that is working on their issue, that they don't have to repeat their story again. However, that innovation, we have to look people to people. Some people, they like that innovation. Some people also need face to face. And it's so meeting everyone at their individual needs set. And so sometimes it's not innovation. Sometimes it's just boots on the ground. Sometimes it is innovation. The person wants the app because they don't want you to come to their house for various different reasons. And I just think it's always individualized care. I think that's how I balance it, and trying and giving people that option of innovation as well as human to human. And I just want to say I've been able to do all of this with the help of COPE. I'm running two organizations with a young baby who you probably heard crying and screaming and sucking breasts now, only because of the support. And so when we talk about providing access, that is the access we're talking about, where we as community organizations, we have the support to be able to do the work. And I thank God that we found COPE, and they have been so instrumental in us being able to reach the people that we want to reach.
This is great. Leah, let's go to you.
I feel the same way. I actually have personal experience with the senior care because I actually started this business because we took care of my great grandma until she passed. And we would have these case managers who would give us like one resource and we would never hear from them again. And it's just kind of like, okay, what are we supposed to do? And it was such a frustrating time because she had dementia, she was declining, So same thing. We provide at Harvest Healthcare, we provide like a case manager for each client. I make sure that they are meeting with them once a week, whether it's on the phone or in person. We have a referral system. Depending on location, we make sure that that case manager in that location has access to the file, to all the information that they need. And so they kind of work with them. We do not leave people hanging. We are constantly making sure they are okay, providing resources. Even when we don't talk to them after our once a week meeting, we're sending resources via email. And I agree, Cope Health has helped us so much. Like I could go on and on about how much they have helped us just structure our business, expand, just give us like the guideline on how to work with the clients. Once again, the resources, it's just been a great experience.
That's wonderful. And Belen, let's hear a little bit about how do you balance, trying to innovate, but also trying to serve and meet the demand that's coming in your door.
Yeah, it's a really tough question, but it's something that we're doing day in and day out. I think a lot of this is being fueled, as I hear from, co-presenters, lived experience. So you do what you can. And from my perspective, I try my best to leverage the resources that we have internally. We may not apply technologies quite in the same way in terms of app development, but we for sure leverage what we have to bring the team together, have a data component that's universal that tracks the data in an ongoing way, where we can make sure that we're meeting those data components that are a requirement as part of the enhanced care management program. And anywhere that we can leverage that to shorten the amount of time that I'm spending on doing that administrative work is really a good investment to then kind of flip the switch, circle back, dedicate that time to the staff, recenter what our focus and our priorities are with those patients. And on top of that, move forward some of the really complex like healthcare navigation that just occurs in general. So are we connecting with our IPA because there's a referral that's stuck, and how do we, kind of move that forward with the patient? How do we support them with transitions of care? So those are the conversations that I want to be a participant of and support to the staff members on a more ongoing basis by being innovative where we can be to operationalize some things that can just kind of just run. So my plan, we don't have this quite yet built in. Cope hasn't jumped in to help, but I'm definitely eyeing Allison right now because it is an opportunity that was presented to us and all of the other work that they've helped us with. So kind of thinking into the future and what kind of data dashboards we can have on a routine basis. So that's something that's more in the background and we use it to support and fuel the work that we're doing boots on the ground with the patients.
This is great. So Allison, I want to go to you only because while this has been, I think, a commercial in some ways around the services that you guys provide, it's also illustrating, that you guys are undergirding the workforce in California who were actually there to do the work. And whereas in the past, we've maybe anchored a little bit too much on just, the traditional provider ecosystem or the traditional payer ecosystem, this is really allowing that interstitial space and the glue that really ties the community into modalities of care and new and novel modalities of care, but also creating wraparound care and services that actually impact people's kind of quality of life. Can you tell me a little bit about workforce and what you're seeing from that perspective, and any lessons learned you've had in meeting and working and diving in with these CVO clientele?
Yeah. So as far as the workforce, as a big part of Medi-Cal Transformation is about integrating individuals with lived experience. You heard Ethiopia tell her background and her experience and how that's helped her tailor her program. That's a huge part of being able to bring those individuals in, because this initiative really focuses on those populations that don't typically engage with care, or maybe have been hurt by traditional providers, just in the way that we provide care across our healthcare landscape. And so benefit to the provider clinics and their specialty providers that are also overstaffed is that these community health workers, these community supports providers, these ECM providers are the individuals that are connecting with Belen substance use patients that have maybe that experience of substance use and know how to connect with them and engage with them and educate them on the benefits of going into their provider practice and getting that screening to close that care gap. And so I think that it's a connection and a support on both ends. The providers, the clinical providers, the clinical specialists can specialize in their area and aren't doing case management, which isn't what they went to maybe to school to do. And our ECM and community support providers and community health workers are able to specialize and really hone into the way that they provide care and the benefit that they bring to our healthcare ecosystem and closing care gaps and really making that closed loop referral that we don't really get to see in healthcare right now because it's so fragmented. So that's kind of where I see it affecting workforce. I think some lessons learned from working within the TA marketplace is that each organization has its own unique setup. The way that you set up your enhanced care management is not one and done for all organizations. It's really specialized. As Belen spoke to, she has 4 or 5 case management programs going on within her system. Enhanced care management is an added benefit to members that may not qualify or align with the requirements of these different care management programs. So now these individuals get an extra resource with a different type of staffing model that works for those members. Leah really, has focused on senior population and now gets to expand her housing work across populations. And Ethiopia has a really complex system where she has doulas integrated and all these, and a really great application that helps with that closed loop referral. So I think the biggest thing is that for any vendor working on the marketplace, you can't really look at these organizations and tell them you can help set them up without understanding their operations and how they want to provide care and engage with these members. And so that's what we really value and try to put into practice when we work with different provider clinics, IPAs, community-based organizations, FQHCs. Yeah.
Wonderful. I know we only have about 10 minutes left. I've been trying to monitor the questions that are coming in, but I want to flip the mirror a little bit. I've been asking questions of you guys, but I would love for you guys to answer a question that you believe people in the audience want to hear. So I'd love to just kind of open up and have you answer a question that if you were sitting in the audience trying to really understand how can I financially improve my performance? What does this really look like? And how do I even start? If you could answer that. And I'm gonna actually start with you, Leah, and we'll go to Belen and then Allison and in Ethiopia, and then I think we'll be kind of over for the day. Go ahead.
I believe my first question when I first started was, how do I actually get started? Because I was presented this opportunity and, not having, I was a case manager before, but just, starting your own business, that's a different ball game. And so I would say definitely reach out to Cope Health Solutions. They can help you set that up. They can help you find managed care plans that will work with the population that you are trying to serve, and just be patient. It's a lot of work. How much work? 24/7, at first. So just be prepared to work. If you don't have the work ethic, I don't know, you have to really put in a lot of work. That's
wonderful. Thank you. What about you, Belen?
Yeah, I come from a different perspective in terms of inheriting an ECM program where contracting was already done, we're already in place. And so now you're looking at it like, where do we go from here? These are the areas of opportunity that I've identified, and how do we help them grow, knowing you're a nonprofit as well, and money's tight. So I think that the opportunity for the TA marketplace, because I've been on board since the transition over into ECM was, one, how are we going to pay for this once technical assistance was rolled out and you make the attempt to fill out the application, you're like, wow, this is a ton more work on top of everything that I need to do. I think that over time, that landscape has completely changed. There are a lot of different consultants that are on there that you explore, figure out what it is that you need, and don't be afraid to reach out to them. They're very supportive. I think, Allison, again, I didn't touch the TA marketplace. I let them know what my needs were, and that application was completed and all of this information was summarized, which is any supervisor, any director's dream, to just kind of inform someone, these are my needs, and then have that help along the way of someone routinely checking in with you. And it's free of cost. So I would definitely take advantage if you have that need.
Amazing. And what about you, Ethiopia?
I think for me, the first thing is, as a CBO leader, getting over imposter syndrome. You are needed. Your voice matters. I remember the first time I went on LinkedIn and I just felt so unworthy that these people with all these, different things behind their names. And I was like, how am I going to help my community? Just knowing, first of all, that you have a voice and your experience, your lived experience matters. And so starting from there and then knowing that, yes, you need the help to do the things that you are wanting to do for your community. There's a saying in the Black community that the hood needs you, but the hood actually does need you. And starting from that point, and I have found that DHCS have been very helpful, and then going into the marketplace and finding a good vendor. And for me, it was Cope. I had shopped around and wasn't so successful with other vendors, was very successful with Cope. And then, always going back to your why, which is to help people in your community. And that is, even when I have been frustrated with the MCPs, sometimes I just feel like I just want to go. I just want to help the people. I just want to help the women. And I just go through the process and just go back to my why. And it keeps me grounded. And I just want to say that your voice matters. And as more as I do this work, I know that I can interact with people. I was like, yeah, y'all need me. So yeah.
Amazing. Allison, I'm leaving the last few minutes and few words for you as it pertains to, if you were on the other side of this webinar, what would you want to know?
Yeah, I think, a lot of you all have hit on it, but, one of the main things is how do I even start? How do I engage? What is the timeline? What is the process? And so, that attestation is the first step. So even if you're interested in it, reaching out to a vendor, reaching out to our team to understand how to obtain that attestation, get in the process so you can get going on the TA marketplace. I think that's one of the things that most recipients lag with, just because attestations can take so long. So even if you're considering it, an attestation does not mean you have to contract. It can mean you're interested in it, you want to learn more about it. So one thing I would push anyone that's on the panel or on our webinars is reach out to obtain the attestation so your organization can start the process while you figure out if this is meant for you or not. I think that's something that holds so many organizations back from launching their ECM and community supports programs in a quick manner.
Yeah. Well, I want to thank everyone. It's been an honor and a privilege to spend time with you today. I get to do this work all around the country, but California is my home, and California is where I have deeply done Medicaid work for well over 23 years now. As a public health leader, as a hospital leader, and as a nonprofit founder. And I deeply know how challenging and difficult it is to be a nonprofit leader, shouldering the community needs on top of you, at times feeling like that weight is really burdening you deeply. So I want to deeply say thank you to Belen and Leah and Ethiopia and Allison. Yes, we have had a female piano kind of powered panel today, but really grateful for the work that you guys are doing. And I would love for the folks in the audience, certainly send in questions. I can be easily reached at HealthTech for Medicaid. I'm sure everyone else on here can also be reached directly. We want to see our communities thrive. And I think in this particular ecosystem, in California as we're looking at an election season in just a few months and potential. And we've also had some just this week, right? Big changes happening at the state level as it pertains to how healthcare is going to be governed. So it's unique and novel and dynamic and, you know, amazing times. And I really want to thank folks for being open and honest and vulnerable today. It's often something we don't get a container of safety to ask questions, to really give our vulnerabilities, and also to cheer people on as they're continuing this journey.
Thanks so much, Adimika. Oh, yeah. Oh, sorry. Thanks so much, Adimika. I also want to thank you for being a moderator during our panelist conversation. You bring great expertise with your years of experience. And then another big thank you again to all of our panelists for sharing their stories and being very open with all of us. And a big thank you to our audience for joining and taking the time on this Thursday during a lunch period to join our webinar. Please reach out if you have any questions. There's info@copelsolutions.com. We also have a website where you can submit questions to directly and get some background on our team and our service offerings, and that's just at copelsolutions.com. So please feel free to send those out. I just want to flag again that we will be sharing this deck and some questions and synthesized answers for this team after the webinar.
Yes, what a pleasure. Thank you so much.
Thanks, everybody. Thanks all.